Mental health is an issue we take seriously at Men's Health, which is why our Mend the Gap campaign continues in our next issue, on sale September 28th. To better understand how mental ill health affects ordinary men in ordinary ways, we partnered with the UK's biggest mental health charities, including Mind and Time to Change, to ask you, simply, how you feel, and what can be done to help. Almost 15,000 of you responded. Our expert panel, including Ricky Hatton and Professor Green, analysed the results, and outlined your plans for the future. Pick it up in all good news agents soon. Mental health services are struggling. NHS staff specifically employed to deal with mental health are taking 22% more stress leave than ever. In these tumultuous times, safeguarding your mental health has never been more important. That's why we're asking everyone to take action. Join us in our pledge to mend the gap by helping your everyday GP deal with your everyday stresses. Not all heroes wear capes. I pledge to demand increased provision for mental health at a local level. A quarter of men who commit suicide visited their GP within a week of their death. In order to save lives, we want GPs to be given greater powers to help those suffering from mental health issues. In addition to this, 28% of total suicides were in contact with their GP in the 12 months before their death. Factor in a 10% rise in people being sectioned under the Mental Health Act since early 2015 and it's clear that GPs are simply not equipped to deal with the increasing demand mental health treatment is placing on their already limited resources. In short, Men's Health believes that, at a local level, mental health care is undersupported and underfunded. And it's simply isn't good enough. To rectify this, we believe it is essential that GPs be empowered to do more than prescribe one-size-fits-all antidepressants, or pass patients on to underfunded crisis teams or an already overworked department. We want GPs to be able to demand 24-hour access to fully funded mental health care and support, catering to those who present between 11 p.m. and 7 a.m., the most common hours for mental health emergencies. And much like every GP clinic has access to a trained alcohol abuse counselor, we want GPs to be able to call for an equivalent mental health professional to be made available to all patients at all times. The Mental Health Task Force's 5-year forward view for mental health plan suggests the training of GPs could also be improved to ensure they're fully supported to lead the delivery of multidisciplinary mental health support in primary care. It goes on to recommend that the Royal College of GPs and he ensure that by 2020 all GPs receive mental health training, while creating a new role of GPs with an extended scope of practice in mental health, with at least 700 in practice in 5 years' time. Crucially, with a little extra assistance and funding, GPs could take just 2 minutes longer per patient to ask how are you as well as simply what's the problem. Let's get one thing straight, this initiative isn't about attacking GPs. Rather, we want to empower our general practitioners to take the fight for fairer and more comprehensive treatment up the ladder. Joining us and you in the call for reform. Not only will more targeted treatments and greater powers at a local level make our GPs' jobs that bit easier, it will also save lives. Go to change.org to sign our petition to empower GPs today. For more on mental health, buy our July issue in shops now, then click here.